8 million people are living with HIV in South Africa, and approximately 6.2 million are on antiretroviral treatment. These figures were released earlier this year by the Thembisile model. As the world commemorates World AIDS Day today, we'll look back at the progress made in medical research to understand the disease and increase life expectancy of those living with the disease. South African National AIDS Council CEO Dr. Thembisile Xulu joins us now for just a little bit more with this and the numbers. Doctor, this is an epidemic South Africa's faced for really decades now. But we're still sitting with a situation where 8 million people are living with HIV, 6.2 still on antiretroviral treatment. What would you say to these numbers, considering the fight that we had been raging against HIV and AIDS for such a long time in the country?
Good morning, Arabile, and you're absolutely correct. It's been 20 years since the government has been offering free antiretroviral therapy. But the truth of the matter that we see is that, for instance, when we experienced COVID, HIV sort of took a back seat, and we are still struggling to get people back on treatment. If you look at how we are measured as a country in terms of performance on treatment, it's what we call the 95, 95, 95. And the second 95 is the worry, which looks at the number of people started and staying on treatment. As you mentioned, only about 6.2 million people are on treatment, and we should have 8 million on treatment. And we are not there yet for multiple reasons. The situation around the funding in February didn't help because funding was pulled off. We lost some staff members, some community members that were funded to make sure that we bring people back onto care, back onto treatment, were also not funded. And complexities related to the funding, related to issues like stigma, are actually contributing to us not being able to get people back on treatment, but also to get them to stay on treatment.
Yeah, and I guess it becomes so tough now because then the question mark is, much like the UN AIDS has been warning, do you think a looming HIV crisis could then be on the horizon, or would it take a lot more to get to that stage?
When you look at a situation like South Africa, I think if you look at the strategies, maybe if I can mention 2 or 3 just in the past medium to short term. Okay, firstly, our HIV response is primarily funded by government. So our situation is a bit different from a sustainability perspective because we have a sustainable program funded by the fiscus. So 90% of our patients actually get their treatment funded by the Department of Finance or Treasury. Secondly, just 2 weeks ago in the Free State, the minister launched what we call the 6 multi-month dispensing. And this is meant to make sure that once a patient is stable on antiretroviral therapy treatment, they don't have to come to the clinic every month, Arabile, miss work, stand in long queues. You get your 6 months worth of medication, which means you only come to the clinics twice a year. That will make sure that people take their treatment on time. And when you are on treatment and your viral load is suppressed, then you don't transmit it not to your sexual contacts, but also not to an unborn baby during pregnancy, delivery, and during breastfeeding. The minister also launched the 1.1 million Close the Gap campaign, where we are now actively looking for the ones that are not on treatment. And our communities that we are working with, the PLHIV sector, are assisting with this to make sure that we bring people back onto care. So I think if there is solidarity, and we are able to mobilize funds from the private sector. This is now globally. And globally, as much as there are other competing priorities, be it war, climate change, etc., we remember that health is also a human right, and HIV is not outside the health agenda. We saw that during the Global Fund replenishment, where big countries did pledge money towards the aid replenishment. Yeah. So if we continue to see that global solidarity plus a lot of domestic investment, we will be in a better place.
So on the funding aspect, we still need a lot more to come through with regards to that to aid the progress, don't we? Because, I mean, thus far, what has it been? Almost $1 billion, so 753 million rand, I think it was, in emergency funds to try and fill the gap. But it won't be enough.
Yes, definitely. So I think the government had requested about 1.4 billion from Treasury, 753 went to the provinces. About 200 million went towards the CCMDD program. This is the courier program that sends medications to patients. And then another 153 million or so went to our researchers. More funds have then been applied for, but you are seeing that private partners are starting to come through, and the DG is leading a program through the DG Murray Trust, where our private sector is saying they are also wanting to put their hands up to contribute. That will yield some results, and we will speak about that. And just last week or 2 weeks ago, the Chinese government pledged $3.5 million towards South Africa's HIV program, mainly looking at key populations and people who inject drugs. The truth of the matter, Arabile, is that whatever the Americans put into the system will never be replaced dollar for dollar, and we need to be more creative and more efficient in how we use the money in order to plug the gaps. Therefore, an example I gave is rather than issuing 1 month worth of medication, give people 6 months, save them some money from coming to the clinics, but also save the nurses time so they focus on the sick patients.
People are also living longer with HIV, though. So that's the advancement of medicine and the like actually helping, as well as the treatment, showcasing the significance thereof. Am I right?
You are absolutely correct, Arabile. People are living longer from HIV, but what we are then seeing is that the more they age, they are then getting the non-communicable diseases. So they are starting to get hypertension, they are getting diabetes, people are suffering from mental health conditions. And for women living with HIV, we've seen that they have a 6 times more likelihood of developing cancer of the cervix versus women not living with HIV. So it's sad when a woman living with HIV lives from HIV but dies of cervical cancer, which is preventable and treatable and curable if detected early. So we are really looking at integrating services so that when a woman has a touch point with a primary healthcare service, she's able to get her ARVs, her chronic medication, get her screening for HPV, and essentially, if there's a lesion in the cervix, she then gets screened and treated at the same time. And this is part of our path of NHI towards universal health care, to make sure that our health services are integrated but sustainable.
Yeah, how do drugs like lenacapavir help? Or will they help in any way? I mean, when one thinks about it, does that change the trajectory of the epidemic, or is it still going to be an expensive one? And over time, because the first drugs only appear next year or in the first 6 months, that goes to government. It being widely circulated then becomes another thing. By 2030, hopefully, we'll then have full circulation of it, right?
Absolutely, Arabile. So lenacapavir is a new antiretroviral drug. It's a long-acting injectable for HIV prevention, and it's meant for people that are not living with HIV. So you get a subcutaneous injection twice a year with a loading dose of some pills, and it's essentially meant to prevent sexual acquisition of HIV. Now, we've got populations that we are targeting, including young girls, female sex workers, men who have sex with men, and other key and priority populations, but also importantly, pregnant and breastfeeding women. Now, the issue that we've always had was the issue of cost. A few of the big pharma companies came together with some funders like Chai, like Gates, and lenacapavir came down from $28,000 per annum per dose, because a dose is 2 injections per year, to about $40. So from an issue of cost, about 120 countries have actually got access to that pricing. But as South Africa, we have been fortunate in that the Global Fund, which is one of our funders, has identified us as one of the so-called 9 early adopter countries that will start rolling out lenacapavir from February to April next year. And as we are rolling out lenacapavir, we are learning lessons related to access, affordability, and sustainability, building our systems. But Gilead, the manufacturer, has also been very open to assisting our local pharma companies towards us getting a voluntary license, so that as a company in South Africa gets the license to be able to produce lenacapavir so that by 2027, the generics will come into the market, and that is when South Africa will be able to produce for South Africans, and we don't find ourselves without lenacapavir when global supply chains shut down like they did during COVID.
Yeah. All right. Do you think we're at risk of losing this hard-won progress that we have made thus far? I mean, one looks at the number 8 million and then thinks of what you've just said, and one realizes that, of course, it is the fact that people are living with AIDS for a lot longer, meaning that the number of people with HIV would then increase because there's also an increase in infections too. Or are we at a point where there's a sense of stability and trying to reverse it is the harder part?
We are at quite a crossroads based on the funding situation that we found ourselves in, Arabile. The funding for HIV, if countries and if domestic funding doesn't come through and if the private sector does not step up, our community systems can't be strengthened, and we need communities to be fully funded for the HIV response to be successful. But we are also at a point where the last time we had successful social behavior change interventions was during the era of Khomanani. We haven't had anything like that. So the young people of today have got no idea. All they know is that treatment works, and if I get HIV, I'll get treatment. So we need to push more on prevention, push more on effective prevention interventions like condoms. Condom utilization in South Africa has gone down to its lowest ever. So I would say if we miss the mark on the funding and we get it right, even just in terms of prevention, and make sure we push the social behavior change, we will be able to keep those 52 million South Africans that are negative, HIV negative, and that is a win, and that is what we want to do. And for the people that are on treatment, the 6.2 million, if they stay on treatment and their viral loads become undetectable, then they will not be able to transmit, and we will be on the way towards a win. But as I said, we need to maintain funding and the strategies for prevention.
Yeah. Doctor, I'm going to make you part of our poll question. We asked our audience today, on World AIDS Day, what is the biggest remaining challenge in ending the epidemic by 2030? We gave them 3 options. We said stigma and discrimination, inadequate funding, limited HIV service. Very quickly, in 30 seconds, what are your thoughts?
We've just released the Stigma Index report, and it shows that as much as people living with HIV are feeling better about speaking on stigma to their peers and to their families, they suffer a lot of internal stigma that makes them not want to go to clinics, not want to hang out with friends, and even lose self-confidence. So I 100% agree with your viewers. Stigma and discrimination is still a big thing.
Yeah, unfortunate. Very finally, just your message to South Africans to take away about the fight against HIV on this World AIDS Day and into the future, really.
Yeah, I would say that the theme for World AIDS Day is renewed efforts and sustainable commitments to end AIDS. And I would say that if every South African makes sure that they are testing, that they know their status, and if you test HIV negative, you either get onto pre-exposure prophylaxis, or you utilize condoms, or you get circumcised as a man. And if you test HIV positive, you start your treatment. If we can get that right, I think as a country, we will be on the path, because what we find around this time is that people still ask, but is HIV still a thing? You know, people are no longer even talking about it. So let's normalize the conversation around HIV. We are even starting, Arabile, to see advanced HIV disease because of the stigma. So let's normalize it. Test, be on treatment, live, love, be well, so that you don't even transmit HIV to your loved ones, not sexually and not vertically as well.
An absolutely critical and important message. Dr. Xulu, I couldn't say it better myself. Thank you so much for the time.